Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us once again today. Anxiety is epidemic among all of us. None of us seem to be immune. Anxiety keeps us stuck. It drains us of our life force, our happiness, our joy. Anxiety covers all social backgrounds, race, gender. It doesn't matter. Anxiety is one of the major problems that we have. Our guest in studio today is Dr. Johnny Kenley. He is a doctor with more than 25 years experience, and he says that talk alone is not enough and that drugs do not cure anxiety. He's also an author. His newly released book, Freedom from Anxiety, a revolutionary 10-minute process, returning clarity and ease to your life, published just this year, as a matter of fact. And he's here with us today to talk about alleviating anxiety for good. How are you doing today, Dr. Kenley?
I'm doing very good, Neil. Thank you.
Great. Thank you so much for joining us today. When we're talking about anxiety, sometimes is it you're running around willy-nilly, you don't know what you're doing, or is it you're simply worried about something and not necessarily showing symptoms, or does it run from the very least amount of anxiety or to just having for lack of a better term, a hissy fit?
Yeah. No. So anxiety certainly is real, and it is an epidemic, just exactly like what you said. If you look at the number of people in the United States that are actually diagnosed and being treated for a disorder called anxiety, general anxiety disorder, that's 40 to 50 million people. Now, if you think about the rest of us, the other 290 million people, we experience anxiety all the time, every day. There's not a person that is excluded from that. And anxiety is an emotion, and it's an emotion where we sense unease and discomfort. And like all emotions reside in the body. It's not something that's in your mind. You may have a thought about something, your daughter, your son, your wife, your work, something like that, a thought, and then you have something in your body that responds to that. What's in your body is an emotion, and that emotion is either fear or loving. So when we talk about anxiety itself is really a word for a shade of fear. We could use tension, we could use stress, or we could use anger, or many other words.
Okay.
But anxiety itself is fear.
Okay. Now, when you just mentioned several terms that I don't know if they're interchangeable. Anxiety, stress, worry, anger, fear, tension. We all experience tension just by getting out of the bed in the morning. I mean, isn't anxiety natural? It's all around us, and don't we have like natural coping skills to deal with this little bit of tension that we get just from having to get up out of the bed, take a shower, get into traffic, deal with people at work? I mean, it's everyday stuff.
Right. And the thing of it is, it's like because everybody is anxious, everybody is in a state of anxiety, we begin to think it's our normal state of being. Mm-hmm. But just look backwards. I don't know if you have any children, but look around you at a 6-month-old child, mm-hmm. your neighbors. They're not anxious. They don't have anxiety. And as life goes on, as they're conditioned with anxiety.
Okay, now when you say conditioned, you say anxiety, is this a learned response, or is it similar to fight or flight?
Okay, so fear itself is a natural response. So mm-hmm. when a child is 1 year old, or you and I, let's take you and I, and we're driving down the street, and someone walks up to our car with a gun, we obviously sense fear, and we want to take appropriate action because it's happened right then. If we're driving down the street and we're worried about being hijacked every second of every meter that we travel, that is an anxious state of being, and that's not a place to live. So fear and anxiety about a situation that's happening right at that given time, that's natural. Mm-hmm. That happens to all of us. It's a response in our body that keeps us alive. So that is true.
Now, I've heard it said that if you are feeling anxious, if you're having anxiety, tension, that you can basically talk yourself down. Is it just a matter of doing positive affirmations, Or why doesn't that seem to work? If that were simply the case, I guess we wouldn't have such an epidemic of anxiety. How is it that you cope with anxiety not knowing that you're not supposed to be in this state of anxiety all the time? We don't know that.
We've lost our sense that our natural state of being is joy and bliss. So we live in this anxious state. So you can certainly do a variety of things to mitigate that or cope, but it's not going away. So certainly you can say affirmations, and at the time that you're saying those affirmations, your focus is not going to be on the thought that was creating the anxiety. And remember, anxiety is in your body. It's not in your mind. So I don't care how bad your thinking is about a situation. You don't need to change your thinking. The thinking is there. The emotion is going to exist in the body, the anxious state. So you can do affirmations. You can do prayer. Now, meditation and mindfulness are certainly beneficial. Mm-hmm. However, the challenge is that not altering anything in the body, which is where emotion and anxiety lies.
In your book, Freedom from Anxiety, a revolutionary 10-minute process returning clarity and ease to your life, you describe a system of anxiety relief called RAIN. Could you talk a little bit about RAIN?
Sure. So RAIN is an acronym for Resolving Emotional Issues Now, with the emphasis on now. And as I said before, when we think of something, we have a response to it, either a loving response or a fear response. And that is going to create change in the energy fields of your body, which instantaneously, in a billionth of a second, changes and puts the emotion in your body. So what RAIN does is that it teaches you how you yourself can alter that energy field so that when you think the thought, when that crosses your mind, the emotion has now been dispersed, discharged, dispelled, resolved, so that it does not exist there. So, as an example, I was in Russia last year, and there was a woman that had a fear of elevators. She worked on the 8th floor, and she lived on the 12th floor of a different building. So every day, she went up and down the steps. That's probably very, very good for her exercise.
Right.
But she didn't want to keep doing that. And it's only been that way for since she was 12. So she was 29. So that was 17 years. This was live on television. I brought her up. She was one of the producers. We went through the RAIN process. It was no more than 10 minutes. Mm-hmm. And when I finished, I said, okay, I said, do you still have a fear of elevators? Yeah, I fear of elevators. I said, okay, well, take your friend here and walk over the elevator and go up and down. So she walked over the elevator. I didn't see her again for an hour and a half. She was just going up and down the elevator. Mm-hmm. Well, the thought is still there. I'm afraid of elevators. But the charge is not there. The energy fields have been changed. And the response, that fear, which resides in the body, is gone. So she just went ahead and did what she needed to do. And it's gone to this very day.
Now, talking about anxiety being in the body and not in the mind, what about these anti-anxiety drugs that are on the market, that are prevalently on the market? They're everywhere. You see them in TV ads, in the print, and on radios. Everything is relieve stress, get rid of anxiety with this pill, that pill, or the other. If it's simply a matter of taking a drug to alter the body's chemistry, why spend 10 minutes when you can just pop a pill?
Okay, so you can't. So all you have to do is ask yourself, or have any of your listeners ask themselves, have you ever seen an anxious person take a medication or take alcohol or take an illicit drug, take those, and then have no anxiety anymore? It's there. It's continuously there. Mm-hmm. Now, can it numb you out? Can it blank you out for a second or two or for an hour? Well, yeah, of course. Because those drugs act on your body, which is where the emotion lies. But they do not solve the situation. Mm-hmm. They don't resolve the emotion of anxiety or fear.
Okay. And were you always interested in being an author and putting this information out there through print, or were you exclusively doing it through your practice?
Well, primarily my practice in the USA had been physical medicine, and I do infectious medicine in Africa, in 2 different countries, Rwanda, Tanzania, and Kenya. But several years ago, about 6 years ago, I became interested in a situation where my whole practice, I saw there was an emotional aspect to
mm-hmm.
a person's pain. And so, for a variety of reasons, I looked at different approaches to alleviate that emotional aspect of the pain. And in doing so, this new field of energy psychology had begun in the mid-'80s and then came together in 1999.
Mm-hmm.
So I investigated that more and took various different aspects of that and applied it to other things that I knew and developed this new program called RAIN, which I teach all over the world, and I treat people in Africa and in the Philippines.
Now, Dr. Kenley, as we wrap up this segment, I'd like to ask you if many people are not aware that they are tense, that they are anxious, that maybe they're even fearful or have a phobia and don't really realize that it's a phobia per se. What are they supposed to do if they're not aware of their anxiety?
That becomes a tremendous challenge because, as I said before, most of us, everybody around us is anxious, so we think that it is sort of natural, and we think we're told by our mother, father, teacher, preacher, to have some anxiety and stress is good. It makes you do better.
Helps you grow.
It helps you grow, or it makes you a better person, whatever. So it is a challenge, and I think that most people at some time in their life hopefully will become aware of it. If you're not aware of it, you only have to ask a friend of yours, like, how do you perceive me? Do you think I'm an anxious person? And they will tell you. They say, oh, yeah, you act like this all the time. Every time I ride with you, you're always yelling at drivers, So other people notice it, whether you are aware of it or not.
And
but the thing is, it can be resolved, and it does not take months and years of talk therapy, because anxiety is not in your mind. It's not stinking thinking. And it doesn't take any drugs. So.
And where can our listeners get more information about your book and about your practice as well as RAIN?
Okay. So the name of my book is Freedom from Anxiety, a revolutionary 10-minute approach to return clarity and ease to your life. You can get that at Amazon.com in print or at Kindle. On my website, Anxiety Solutions Now, there's a lot of information on the coaching that I do, the half-day workshops, the other workshops, lunch and learn programs that I do here in the United States now, and it works. The beauty of this is it's about knowing. I can say I think something is okay, but when I say I know it, that takes on a completely different meaning. So when you have a problem and you say, I know it, I think it's gone, or you say, I know it's gone, there's a huge difference. And when you use the RAIN process, you immediately know. It's not a matter of maybe, or 30%, or what have you. Your anxiety is gone.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, and we've been in studio today talking with Dr. Johnny Kenley, certified energy therapist, an applied kinesiologist and acupuncturist, as well as a physician specializing in physical medicine, holding an advanced degree in clinical nutrition. And we've been here today talking about what actually anxiety is, how it is not a condition of the mind, even though it is said that it's one of the most prevalent mental health conditions. We've been talking about how the body is actually the main thing affected by our anxiety, and we've been talking about ways to alleviate anxiety without drugs or years and years of self-talk. It's been great having you here with us today, Dr. Kenley.
Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.